Yahawret, what metabolic diseases? The silent epidemic, science, root causes, and the path to healing. Our introduction. Metabolic diseases are not rare disorders. They are not diseases of old age. They are not confined to rich countries. They are now the most common health problem on Earth. Diabetes, obesity, fatty liver, hypertension, PCOS, heart disease, gout. These are not separate illnesses. They are different expressions of one underlying disturbance: metabolic dysfunction. Metabolic diseases develop silently, slowly, and invisibly, often years before symptoms appear. By the time blood sugar rises, blood pressure increases, or cholesterol changes, the metabolic damage has already been present for a long time. This lecture explains what metabolic diseases really are, why they are increasing explosively, the true root causes, and how they can be prevented, reversed, and healed when addressed correctly. Part 1. What are metabolic diseases? Metabolic diseases are conditions in which the body loses its ability to handle energy properly, respond to insulin, burn fat efficiently, control inflammation, maintain hormonal balance. Common metabolic diseases include insulin resistance, prediabetes, type 2 diabetes, obesity, especially abdominal fat, fatty liver, NAFLD, hypertension, dyslipidemia, high triglycerides, low HDL, PCOS, gout, metabolic syndrome. These conditions cluster together because they share the same biological roots. Part 2. The core problem: insulin resistance. At the center of metabolic disease lies insulin resistance. Insulin is a hormone that moves glucose into cells, promotes energy storage, inhibits fat burning. In insulin resistance, insulin is present, sometimes very high. Cells stop responding properly. Blood sugar rises, fat accumulates, hunger increases, inflammation increases. Type 2 diabetes is not a disease of insulin deficiency. It is a disease of insulin overload. To Part 3. Chronic inflammation: the silent fire. Metabolic disease is an inflammatory condition. Contributors to inflammation: excess sugar and refined carbohydrates, ultra-processed foods, refined vegetable oils, gut microbiome imbalance, chronic stress, poor sleep, physical inactivity, inflammation damages, blood vessels, insulin receptors, liver cells, brain cells, hormonal signaling. This creates a vicious cycle: inflammation, insulin resistance, more inflammation. Part 4. Mitochondrial dysfunction: the energy crisis. Mitochondria are the cell's power plants. In metabolic disease, mitochondria become overloaded. Fat and sugar are not burned efficiently. Energy production falls. Oxidative stress rises. This leads to fatigue, weight gain, brain fog, exercise intolerance, accelerated aging. Metabolic disease is fundamentally a cellular energy disorder. Part 5. Role of diet in metabolic disease. Major dietary drivers: white refined sugar, refined carbohydrates, sugary drinks, artificial sweeteners, ultra-processed foods, frequent eating, constant insulin stimulation. These foods spike insulin repeatedly, damage gut microbiome, promote fat storage, increase inflammation. Metabolic disease is largely a disease of modern food environment. Part 6. Gut microbiome and metabolic disease. The gut microbiome plays a central role. Dysbiosis leads to increased endotoxin, LPS, absorption, chronic inflammation, insulin resistance, fat storage, hormonal imbalance. Healthy microbiome improves insulin sensitivity, weight regulation, immune balance, mood, and sleep. You cannot fix metabolism without fixing the gut. Part 7. Metabolic disease and heart disease. Heart disease is a metabolic disease. Key drivers: insulin resistance, inflammation, triglycerides, small dense LDL, endothelial dysfunction. Many heart attacks occur with normal cholesterol. The real issue is metabolic inflammation, not cholesterol alone. Part 8. Metabolic disease and brain health. The brain is also affected. Insulin resistance in the brain, neuroinflammation, reduced glucose utilization. This contributes to depression, anxiety, cognitive decline, Alzheimer's disease, type 3 diabetes. Part 9. Can metabolic diseases be reversed? Yes. In many cases, metabolic diseases are reversible, especially in early and middle stages. What works? Reducing insulin load, correcting diet quality, improving sleep, increasing physical activity, managing stress, restoring gut health, correcting micronutrient deficiencies. This is metabolic rehabilitation, not symptom suppression. Part 10. Foundational strategies for metabolic healing nutrition. Reduce sugar and refined carbs. Emphasize whole foods. Healthy fats. Olive oil, nuts, seeds. Adequate protein. Fermented foods. Eating pattern. Avoid constant snacking. Consider time-restricted eating. Respect circadian rhythm movement. Daily walking. Resistance training. Muscle is a metabolic organ. Sleep, 7 to 8 hours. Correct sleep timing and position. Stress regulation. Breathing, meditation, nature exposure. Conclusion. Metabolic diseases are not inevitable. They are not genetic destiny. They are not irreversible. They are the biological response to a mismatched environment. An environment of constant food, constant stress, poor sleep, and disconnected living. The body is not broken. It is responding logically to chronic overload. When we reduce the overload, restore natural rhythms, feed the body real food, allow insulin to fall, calm inflammation, support mitochondria, the body begins to heal, often remarkably. Metabolic health is the foundation of longevity, mental clarity, hormonal balance, disease resistance, quality of life. True medicine does not begin with drugs. It begins with restoring metabolic intelligence. And that is where real healing starts. Holistic Wellness Foundation, How Imphal, Haur Healing Beyond Boundaries.